Hello, my name is Nicola and I'm a clinical specialist physiotherapist here at Cambridge University Hospitals. When undergoing cancer treatment, it is safe to remain active and participate in exercise. Generally, there are very few contraindications to particular types of exercise, even with complex disease or when undergoing intensive treatment. There will, however, be times when you will need to modify the type or the intensity of exercise that you are undertaking. This is called anemia and affects the ability to carry oxygen to cells around the body, which can make you feel tired, breathless and lightheaded. Whilst there is some evidence to suggest that exercise can improve anemia, we would recommend low to moderate exercise only and a very slow increase in activity intensity as you feel comfortable. This condition is called neutropenia and can mean that you are more likely to pick up an infection. Exercise, however, has been shown to increase white blood cell and neutrophil levels and so should not be avoided altogether. If you feel well enough to exercise, try to continue with low to moderate intensity activity, but either exercise alone or with members of your own immediate household only. Try to exercise outdoors, avoiding public exercise spaces such as gyms and swimming pools. In REACT, we're able to adapt our rehab surroundings so that immunocompromised patients can exercise safely. This is called thrombocytopenia and reduces the ability for the blood to clot, making you prone to bleeding and bruising. If you have a low platelet count, we would encourage you to keep to an exercise program which focuses on light resistance training, gentle stretches, short walks and low intensity spells on a static exercise bike only. Contact sports and vigorous intensity exercise should be avoided. This is a common side effect of chemotherapy, where you can experience numbness, reduced sensation, or pins and needles, tingling, and burning in your hands and feet. This may affect your balance, leaving you feeling unsteady and more prone to falls. It can also mean that you occasionally drop items that you are carrying or struggle with tasks such as craft work, doing up buttons and zips, or tying up shoelaces. If peripheral neuropathy is becoming an issue for you, you may need to modify your physical activities to keep you safe and reduce the risk of falling, such as performing seated exercises rather than in standing, using walking poles or resistance bands, and weights with different handles and attachments. The risk of bone fracture in both of these conditions is increased, but should not mean that you avoid exercise altogether. It's really important to keep your bones and muscles strong and avoid long periods of reduced or sedentary behaviour. You may need to modify your exercise regime to include a mixture of gentle cardiovascular and aerobic exercise with low impact activities and exercises which can improve your balance, such as in Tai Chi. It's best to avoid rapid twists and rotations of your trunk and high velocity contact sports. For a long time, exercise has been discouraged in patients at risk of developing lymphedema. Whilst there are sometimes early exercise limitations encouraged post-surgery on individual patients, exercise on the whole is safe and encouraged in patients at risk of or living with lymphedema, as long as the introduction of the movement and the progression on the intensity is sensible and gradual. For those who have established limb swelling or lymphedema in a limb or elsewhere on the body, you may have been advised to exercise only whilst wearing a compression garment to aid lymphatic drainage. Some patients experience skin reactions and tenderness in areas where they are having or have had radiotherapy. This effect is normally only temporary, but some patients may need to adjust what activities they participate in until the skin settles down. Fatigue is one of the most common side effects of cancer treatment and can leave you feeling exhausted, causing a lack of energy, poor memory and brain fog. Exercise can help with managing the feelings of fatigue, but it's important to recognise which activities boost energy levels and which ones deplete your energy reserves. Pacing, energy conservation, effective rest and relaxation alongside graded regular exercise can help keep your muscles strong and release chemicals into the blood and the brain which can help boost your mood and your energy level. Some patients who have a central line in place may be given specific guidance on exercise. please visit the Vascular Access page on the CUH website to find out more information on your central line or talk to a member of your treating team. Some surgical procedures, such as breast reconstruction, stoma formation, muscle or soft tissue flap transfer or orthopaedic stabilisation may also require some exercise modification, and your surgeons may recommend a specific exercise recovery programme. The primary aims during treatment are to maintain a healthy body weight and enjoy a diet that contains enough fuel and nutrients to help you recover well and heal. If your food and calorie intake, however, is significantly reduced during your cancer treatment, it may not be advisable to participate in moderate intensity exercise because it will further deplete your limited energy reserves. Try instead to reduce your sedentary behaviour and remain physically active, but make sure that you are getting the best possible nutrition and dietary information and input. There are, however, some contraindications to exercise which apply to everyone regardless of their cancer treatment. Any new chest, jaw or arm pain, vomiting or diarrhoea, irregular or unusually high or low blood pressure, a new onset of fainting or dizziness, severe bone or joint pain, any swelling or bleeding should all be flagged to your treating team and investigated as required. In general, please try not to think of exercise as black and white, do or don't do. There are always other forms of physical activity or exercise that can be undertaken if you're experiencing any of the symptoms or if you're feeling generally unwell that day. Thank you for watching. If you need more information or guidance, speak to your treating team about a referral to REACT or visit the REACT page on the CUH website.